Hi, welcome to You and Your Health. I'm your host, Dr. David Bertone. Today's show, we're going to be talking about concussions, and particularly concussions in youth sports. The Centers for Disease Control have determined that approximately 250,000 people aged 10 to 19 go to the emergency room each year with concussion-like symptoms. This has obviously become a big problem in our country, and legislators have taken some efforts to begin writing legislation on how to prevent this problem in the future. Our guest today is Dr. Stephen Rice. Dr. Rice is the director of the Sports Medicine Center at Jersey Shore University Hospital. He is also a member of the Concussion and Sports Committee of the Brain Injury Alliance of New Jersey and is board certified in both pediatrics and pediatric sports medicine. Dr. Rice, welcome to the show.
Thank you. Good to be here.
Yeah, great. Just tell us a little bit more about your background and how you got involved specifically in sports medicine and concussions.
Well, I'm a pediatrician who, during my residency in Seattle, Washington, got involved kind of like twisting my arm to help out with a local high school doing sports medicine. And at that time, we, at the University of Washington, had the first academic division of sports medicine in the country. We're doing injury research. And I kind of noticed the discrepancy between what we knew and what was actually happening at the level of the schools. And it gave me the idea to create a model program for high schools to prevent and model and manage sports injuries. And when I finished my residency, by good fortune, a position opened up to be one of the team physicians for the University of Washington. And from that, we were asked to help out in the local Seattle schools. And I said, what about my model? And one thing led to another, and here I am many years later. So,
yeah, so I mean, sports medicine has really grown over the years, and you've been involved with it for many
almost
years.
From the beginning. I mean, not the very beginning, but close enough.
Great. Let's talk a little bit about what concussions are, just basically for parents and people in the audience. What is a concussion? We hear people say the term traumatic brain injury and concussion. What is actually happening when somebody sustains a concussion?
Well, it involves the brain being shaken up in some way, whether by a direct blow to the head or to some other part of the body that sends an impulse to the head. And in that movement of the brain in the skull, it has a functional disturbance. And it does not involve any actual hardware damage. It's more software functional damage. So there usually will be no bleeding, there'll be no skull fracture, and we talk about it as being mild traumatic injury because it isn't all those terrible things. Yeah. And so the question, we can talk a little bit more about the chemistry of what actually occurs, but if you disturb the function of the brain sufficiently, you begin a chemistry change in your brain, and that leads to symptoms, and that leads to taking time for it to heal. Mm-hmm. And I think that's part of what we've learned in the last number of years, is that once it starts, we can't say it didn't happen, and now we have to learn to recognize it and to manage it properly. Okay. One thing, couple things, the nose. You do not have to lose consciousness to be concussed. Only about 5 or 10% are lose consciousness. It's more than just memory loss. It's headache, it's dizziness, it's balance problems, it's visual issues, it's noise sensitivity, it's mood changes. There's a whole variety of symptoms, although the ones people focus most on are whether you can concentrate and pay attention, whether your memory's intact, whether you can see okay, whether you feel dizzy. All those are the main pieces.
Now, what are the early signs? I mean, typically, you know, mood changes and stuff is not going to be noticed immediately. What are kind of the immediate signs when somebody comes off the field? What are they going to report?
First of all, they'll appear stunned or dazed for sure. They may complain of a headache. You can just almost see a glassiness in their eyes. They don't look sharp, and they will have difficulty perhaps remembering what happened. They will just not be focused and not able to really concentrate. They may be very dizzy and have loss of balance. If you see someone get up and you see them stagger around a little bit, that's a pretty good sign just from a distance that something has happened.
Will they also report things like nausea, or will they vomit on the sideline?
Nausea and vomiting do occur. In my sense, not as frequently as people like to think. We know that nausea and vomiting are heavily associated with more serious injury. But a significant percentage will present with both nausea and vomiting. But I think of the other cognitive changes, the mental focus change, as being the strongest signs for me. And the complaint of headache is probably number one.
Okay. What are some of the common sports or recreational activities that you see the highest incidence for, and we're talking about youth sports. I mean, the professional leagues, we know the incidence rate is higher in the football players and hockey and such, but what about in the youth sports and recreation?
Well, collision, anything with collision will get you there. So you will see those. You will see your share that will happen in baseball, getting hit by a ball or a bat or colliding with someone else. You'll see it occasionally in basketball, taking an elbow to the head or falling on the floor. You'll see it in lacrosse, getting hit by a ball. You'll see it in softball, getting hit by a ball.
Soccer.
Soccer for sure. Not from heading, but usually from elbows or head to head, or hitting the ground or hitting someone's knee or goalpost. We'll also perhaps see it in skateboarding, and any sport with speed where you can hit your head or stop suddenly can cause that. So falling off a bicycle, helmet or no helmet, you can get that. And the same way if you're skiing and you hit something and stop, you're likely to be concussed
I think that's important because most parents think of it as the organized sports is the problem, but some of the recreation things, the skateboarding and stuff, has a high incidence as well. So it's important for them to be aware of the signs when the kids come home. What is the typical workup when you see somebody that's had a concussion? Maybe they didn't go to the emergency room and they come to see you. What is it that you're typically looking for, and how do you work them up to see what the problem is?
Well, we basically are trying to get a very careful history of what happened, exactly what happened. So we can, in our minds, visualize what the injury was and get an idea what part of the head was hit, how fast they were going, and what kind of signs that they experienced right away. And the quicker you can see it, so if you see someone if I'm covering a game on the sideline, I'm with them right away. If it's the next day or over the phone, I want to know about, again, do they lose consciousness? Do they have trouble with memory, their balance, their headaches, nausea, vomiting? Did they have any issues falling asleep, staying asleep? Do they feel like they're in a fog? They have trouble concentrating? So we ask those questions very carefully, and there are 22 questions that get asked. And we ask them to rate and evaluate from 0, no problem, to 6, unbelievable. So we can score as high as 132. And typically people who are concussed will be anywhere from 20 to 80 or 90, depending on how severe it is. So knowing that symptom score right away is very helpful. And if someone is there that can quiz them or check their balance. So we really are looking in a number of domains. We want to know what their brain's doing thinking-wise. We want to know how quickly or slowly they're reacting. We want to know something about their balance, their dizziness, and also just their general sense of positioning. Can they control their movements smoothly and effectively? We also want to know a little bit about their past. Have they ever had concussions before? Have they had troubles with headaches, especially migraines? Do they have any kind of learning disabilities? And do they have any kind of issues of emotional, mental health, anxiety, or depression, or other mental disorders? Because all those give us a clue that the brain is not perfect before and would suggest in those cases the potential for a slower response.
It sounds like there's not a lot of physical signs. It's more of inward signs, and questioning will help determine what's going on with the person.
There's not a lot that you can tell. And that's one of the problems in management, is because they look okay to some people. But if you really look at them, you can see that dullness in their face. They're just not able to handle it. And a lot of people have trouble with the noise and the light as well.
Okay.
I do want to comment about the emergency room, that one of the problems, well, we'll kind of get there
eventually,
circuitously, but the thing that we want to do is we want to rest the brain. That's the best thing we can do. Give it as little stimulus as possible, because in a concussion, it's a functional problem, not a structural problem, and the brain will heal itself over time. And going to a place like an emergency room that's really busy, noisy, full of activity is actually in many cases going to make someone's symptoms worse. So if we don't think they're progressing into getting worse over time, then they may not need to be at the emergency room. And I would not recommend that everyone automatically go to the emergency room, because I think that you want to follow someone. Your worst in general right after the injury occurs, and over time you should be progressively getting better, although a few symptoms may come a little later. The general pattern is you're improving. If something happens when you start to deteriorate or get worse, or you get better for a while, then get dramatically worse, then we may think there's bleeding or something going on. So if you're bleeding, then we need to definitely identify whether that is or is not happening. And that's where the emergency room is valuable, because they can do a CT scan and determine whether you're bleeding and whether you need intervention. But the problem of going to the emergency room and getting a CT for everybody is that these are a lot of radiation, and they're not benign in the sense that they do potentially carry the risk years later of having so much exposure to radiation to the brain that there is a possibility of having a tumor or something many, many years later. So we are learning in the pediatric and emergency world not to be so anxious to automatically get CAT scans of people, to really think, do they need them?
Yeah.
And if they need them, that's okay. So in my way of thinking, if you don't need the emergency room because this happened, you're being followed, you're doing better, the parents can just observe the child. We no longer recommend waking them up every couple of hours, because
that's a misnomer.
We understand what they need is rest. And the rest they're going to get from sleeping is the best rest they can get. So you can go in and listen to them and hear them breathe, and that is a way in which we can monitor them.
Is there anything parents should know, like, particularly that, yes, you do need to go to the emergency room? Is it loss of consciousness? Is it outward sign of neck pain? Or is there any sign that say,
we do need? We have a whole variety of red flags, and we actually have a handout sheet that I have prepared. Loss of consciousness, if it's just a few seconds, not associated especially with any problem, but more than a minute or two or three, definitely you have to be concerned there. Neck pain is another area, because you could have a neck injury as well. Someone who starts to get better then gets worse. Someone whose head pain gets just really unbearable. Someone who's doesn't know what anything is around them, and especially if they're getting worse. These are signs of knowing that we have to take a better look.
Okay.
But for the most part, I think you can go on a pretty good gut feeling of, are they getting better, or are they deteriorating? But an example of the speed with which you have to understand this is, you go out, someone's hit, they're unconscious, they wake up, and then 3 minutes later they go unconscious again. That second going unconscious, that's a red flag.
Okay.
And that's an immediate, has to go, because once you regain consciousness, you should be on the path to no longer being unconscious. And so those are the kinds of things. You're getting better, suddenly you get worse. Those become the issues that we definitely get concerned. And multiple vomiting and nausea, where you're just nonstop, again, that could be a sign of increased intracranial pressure.
What about the typical length of time to recover from a common concussion? How long would it take for a young athlete?
Well, that varies a great deal, depends upon the age of the child, what happened,
degree of impact,
and all of those things. And so it can be from several days to several weeks, as we're learning now, even to several months. I want to come back to the point you made about the workup and evaluation. After we do all those history things, we do a physical examination, and especially we're looking for what happens in terms of your balance, and there are a variety of tools for measuring balance, and I know you have been involved in that area very closely, and that is important, because balance is one area. Dizziness is another, of whether if we make your eyes go from side to side quickly, or up and down, or turn our head and look at, does that make you more dizzy? If those do, those are definitely a sign for us. And then the simple things, finger to nose, and some of the other evidences of general balance tell us what's going on. We also will ask you questions that will challenge your memory. Can you remember words? Can you recite numbers to us in reverse order? There's a number of things, do you know where we are, that tell us whether your thinking capacity is working. And then as part of the evaluation too, we have a tool that's a neurocognitive test that puts people on either computerized or pencil and paper, these days almost always computerized, that tests various brain functions, like your memory of words, your memory of shape, your speed of processing information, and then your reaction time from the minute you see something happen, or the second you see something happen, till you can actually push a button or hit the right key to see how quickly you're thinking. Because your brain function slows down quite a bit.
After the
injury. So that's just really important that we get an idea, a handle of where you are. But that first day, or second or third day, we don't really want to test you on that elaborate test, because we know you will get worse over the first few days, and it'll take a while to recover. So what our experience has been is that it takes essentially at least a week for anyone to get better from what the science has been telling us of late, that you feel symptoms, they may come or go, but you will actually have, because of the chemical changes we mentioned, you actually will have diminished function over several days, and then you work your way out of the trough.
All right, well, when we come back, we're gonna go over some of the cognitive imbalance testing and some things that can be done for prevention of concussions in youth sports.
Alzheimer's disease, if left unchecked, will strike millions, including baby boomers, their children, and grandchildren in the coming years. As a scientist studying Alzheimer's disease for the American Health Assistance Foundation, I'm well aware that continued research is our only hope for finding a cure. Call 1-800-437-2423 or visit ahaf.org for free publications on Alzheimer's. Learn what you can do to help battle this deadly disease.
Hi, welcome back to You and Your Health. I'm your host, Dr. David Bertone. Today we're talking about concussions in youth sports, and our guest is Dr. Stephen Rice. He's also a clinical professor of pediatrics at the University of Medicine and Dentistry. We forgot to mention that before, so I want to make sure I got that in. Dr. Rice, we were talking before the break about recovery from concussions. You had mentioned some important things. I know you wanted to talk about rest and why it's so important.
Well, what is the definition of rest? I think most people know that when you're concussed, you should not go back to playing sports or do physical activity, and I guess we'll talk in a minute about more of that. But rest really means anything that uses your brain. So anything that involves thinking, anything that involves being in a social environment and atmosphere, you need rest from. And we need to get your symptom score down to its baseline level, which is around 10 or less. And that also means two other places that I would avoid when I'm having symptoms of a concussion. Not only the emergency room wasn't such a great place, but school isn't a good place, nor is a busy place like a mall or a sports event, because there's too much activity going on. And we really recommend that we hold people out of school until their symptoms are under control, because school is a busy environment where they're trying to teach you when your brain isn't ready to learn because you can't remember or you can't think or work fast enough. So it's very important that you make contact with your physician and that they understand the whole way in which we manage rest. And rest at home means, unfortunately, no internet, no
Xbox,
video games,
yeah.
no Xbox, no loud music. We really want what we call cocoon therapy, in a way of just quiet and as little stimulation as possible, because your brain heals spontaneously by itself. We don't give you medicine or rehab exercises, and we have to just give it the chance to heal, and nothing is better than rest than that.
Well, let's talk about the devastating effects, especially multiple concussions. The term is second impact syndrome. If somebody goes back too early from a concussion and gets another trauma. Let's talk about what that means.
Well, second impact syndrome is a very scary syndrome to everybody, to the people who experience it and to those medically who are involved caring for individuals. Because if you have symptoms of a concussion that are not resolved and you take another hit, this creates a circumstance where you're not able to control the flow of blood and fluid in your skull that has to go in and out in equal amount, and your brain swells. And in the process and rapidity of swelling, it can actually cause your brain to become a sponge, and then it squeezes on itself because the skull won't expand, and you literally try to push your brain out of your skull into your neck, and you wind up most of the time dying. And this can happen instantly within minutes on the field, and people don't even make it to hospital. So this is something to clearly avoid. It's not all that common to have. It's not happening by tens of thousands, but there have been enough of those cases that have occurred that everyone is really on the alert for making sure that no one who is having symptoms of a concussion should be back doing physical activity. It's just too great a risk.
And I think that's been the impetus for some of the legislation and the government starting to get involved with prevention programs, because kids were going back too soon. Coaches were not educated. They were pushing kids back. Oh, you just banged your head, get back in. And now they're being forced to get educated. So let's talk a little bit about the legislative implications, and maybe specifically about the current New Jersey law regarding concussions.
I was involved in the state of Washington over the case of Zachary Lysted that happened in 2006 that led to the law, the first law in the country in the state of Washington. And now it's come to some, I think the time New Jersey was involved was 20 some odd states. Now I think it's over 30. And it really has three elements that are very important. One is that if you have symptoms of a concussion, any of the things we talked about, that person is to be removed from activity and not permitted to return until evaluated by an appropriate health professional. So we get them off the field and we do not re-expose them. So I think that's very, very important. The second piece is that when your symptoms go down to baseline level, that you have to go through a graduated step series of slightly increased physical activity challenges, one by one, till we get you all the way back. And finally, that you cannot get back on the field unless you have a written approval from a physician who has been monitoring and following you. And that's very important of all three of those elements, that we get them out of harm's way. They don't go back until we can show that it's safe to go back and that a physician has been involved in making that decision. I think that will help us protect. Now, we have to make sure that everybody who's involved in this process is educated and current, because everything has changed so much in this arena in the last 20 years that not everybody is in the year 2012. So that we have to make sure that all of our medical providers are current and know the information.
I think you you mentioned something very important, getting the athlete back to baseline. And that's something I've been advocating for a long time. What exactly is baseline?
Right.
And a lot of times physicians are not given any information about their status beforehand, so how can they compare to where they're at? And let's talk a little bit about baseline testing.
Well, there's a couple of pieces. The one thing that the physician has is he knows the child when they're not in a state of being concussed. So when they come in and you look at them, you know whether they look like themselves or not. So that is very helpful. But the idea now is that with the combination of our being able to measure their mental cognitive functions, like we mentioned with these neuropsychological testing that can measure your word memory and your processing speed and the like, we can get a profile of where you are. Now we also have means of measuring their balance, coordination, things beforehand as well, so that we have comparisons to set the change to know when they're not normal, and then to be able to figure out they're back to where they were before. And that's very helpful. So we're going more and more to testing people. The neurocognitive testing is pretty much taking over most of the high schools. Many of the high schools in New Jersey are already doing that. And I think the balance type of testing is going to be the next step of where we're going to go to get a profile on everybody. It would be wonderful if we knew that at everyone before they did sports.
I think that's important. The professional level, every athlete's tested, both cognitively and balance. The college level, everybody's being tested. The high schools are doing the cognitive part. They think the balance might be a little too costly. The youth sports is not getting anything, and that's my concern. And I've put programs together to try to start educating the youth groups that, yeah, they can get cognitive and balance tested as well, because then it's going to help you make that decision. When are they truly ready to return to activity?
Well, the cognitive tests are only valid, we think, at this point for children 11 and older. So that if you're younger than that, we really... And the other thing is there's so much change as even to balance, that as the children are growing and developing, that someone who's 8 or 9 or 10, 11, and 12, they're going to be marked improvements. So if you did your baseline 6 or 8 months ago, that might no longer be an appropriate benchmark. As they get into high school and older, the changes are there, but they're not quite as significant. So these are things that are ever evolving and trying to figure out what is normal, what's appropriate changes. I mean, I guess it's like weight. If each year a kid gets bigger and bigger and they weigh more because they keep growing. So we can't expect them to stay in a static place. So these are the challenges that we have in trying to figure out what's the most effective and efficient way of measuring everybody.
Yeah, when I talk to groups, I mention to them that we need to do it at least every year, at least to get something in there. But it's better than nothing. Yeah, there is changes every 6 to 8 months or so, but get some kind of baseline in there, some kind of comparison. It may be slightly different than after injury, but at least it's something to compare to. Let's talk about some of the future models, and you think some of the trends going forward in concussion care and prevention. What do you see, how do you see this going forward?
I think our first place of stepping forward is absolutely educating everybody. And the people who got the highest marks are the Centers for Disease Control, who have put out educational items for parents, for children, for youth coaches, for high school coaches, for physicians. So everybody has a chance to be educated. There are a lot of online courses to explain what's going on. So I think that's been a huge, huge help. The Brain Injury Alliance in New Jersey has stepped to the plate and has a lot of literature and things that are very, very helpful. I think our next level is really to make sure that all of our health providers are on board and that we can be sure that everybody is current or has access to current information. And again, it's pretty simple because things are available online at no cost or low cost, and you can become appropriately educated. Then there are questions of, are there ways that we can put something on somebody to prevent concussion? And we're really not there yet because the football helmet was designed to prevent fractures. But people bang their heads together thinking, no, I can't get hurt, I have this helmet on, but it doesn't really protect well against concussion. There's some research putting little sensors in to get an idea of the force of the hits that are going on and to figure out which hits cause concussion, which don't. It's not always the hardest hit that causes a concussion. So I think if you see what's going on, you have a better chance of defending yourself. And then the question of whether these headbands for soccer players is really little evidence that suggests that they do anything either. But again, maybe someone will someday come up with something that will work. Being safe and intelligent. I mean, if you're riding a bicycle, by all means wear a helmet. If you're skateboarding or skiing or things, these are also the chances of high speed, falling off and hitting something and getting a serious head injury are real, and they're life-changing. That's the problem, that we talk about the concussion, but if you get a more serious injury, it can truly be a permanent life-changing issue. So it's more than concussion when we're talking about the concepts
Head
of
injury,
prevention. Yeah, we're really stepping into the big picture.
I think media is helped in that regard because it's become more mainstream and they're talking about it more. And unfortunately, there's been deaths on the ski slope, and now you don't see anybody really without a helmet on a ski slope. So that's really kind of helped things. You mentioned briefly about the recovery and the rehab from concussions. Can we just talk briefly about that? I know there is when I work with my patients, a graduated kind of return to play program. What is involved with that, and what do you recommend?
Well, the first thing is if we've rested you and rested you and rested you, then we want to find out if we increase your heart rate and the blood flow goes to your brain, will the increase in blood flow. So we want to increase your blood flow without moving, so you're not bobbing, moving your head around. So we'll put you on an exercise bike and we'll see, does that give you symptoms? If that's okay, then the next day we'll have you run, so you're moving around and increasing your heart rate. Does that give you symptoms? If that's okay, then the next day we'll have you do little light drills, whatever your sport is. It could be fielding grounders, kicking a soccer ball back and forth, tossing a little cross ball, whatever. And then if that's okay, then the next day we'll let you get into a more full scrimmage. And then if that's okay, then we'll let you get back into competition. But those 5 or 6 steps along the way, but you'll get that first step. So the first step is the one that says you're not having symptoms, you can go back to school, you can live a normal day without becoming worse. Then we let you go on to the next one. So that's where the 6 steps come in. In the really young children, where we don't have as much medical support, there aren't team physicians, there aren't athletic trainers like in high school, we'll often wait a week after they've become symptom-free before we start that, just to be sure that everything's okay. And you're also, during this time, you're not doing physical education either. You're not running around with your friends, and you're not horsing around with your brother or your sister. You're really resting to get those symptoms down. The quicker we institute that rest, the quicker we get better. And the more carefully we follow that, the better off we're going to be.
Great. Well, thank you very much for joining us. It was,
thank you.
Very educational. You heard today from Dr. Stephen Rice speaking about concussions in youth sports. And I just want to end with the fact that as a parent, remember, when in doubt, just sit them out. Again, thanks for joining us. I'm your host, Dr. David Bertone, and you've been watching You and Your Health.